Cervigard Spinal Bracing Corporation presents a new product that addresses the common issue of neck pain, which affects close to 30 million Americans. We'll be talking about a common source of neck pain called forward head posture, meaning the head is positioned in front of the shoulders, resulting in neck strain, particularly in the middle of the neck. It comes from accidents and trauma. However, it also comes from the proliferation of electronic devices in everyday usage, which causes people to look down for long periods of time. This causes a remodeling of the muscles and ligaments in the neck, leaving the head protruding forward. The correction for this problem is to get the head back on the shoulders where it belongs and correct the neck curve. This is done using the Cervigard Forward Head Posture Correction Collar. It's worn around the neck and allows the head to be realigned over the shoulders. The gentle arcing of the forward neck curve will resume the normal alignment of the spine and rid the patient's symptoms of headache and neck pain caused by the forward head posture.
Hi, I'm Dr. Ron Delano. I have with me Jen. Jen has an issue with forward head posture that is causing her neck pain, headaches, and I'm going to show you quickly how this works for her. Now, I've pre-measured it for her so that we can save time, but simply what it does is it slips on behind the patient, and then there's a gate in the front that connects the track. You'll see there's two tracks on either end, and the wheels that turn symmetrically, equally, to bring the head back over the shoulders. Now the cheek pads contact in a proper position. Some people are shorter and taller, so you can adjust the height of that. And Jen, I want you to go along with the collar. See how it's pushing you back? Okay, so now the collar is in position, simply like that. Here's the front, cheeks on either side of the nose, side position. The ears are over the shoulder. Now in the back of the collar is a lordosis pad. It has the ability to go in and out and support the cervical lordosis if the neck curve has been too straightened. So the way we adjust that is simply to turn it clockwise, and it moves the fulcrum forward. Counterclockwise backs it out. Now you wear it as a patient every day at 20 minutes a day for up to 6 weeks. And this is preset by the clinician or doctor or chiropractor who sets you up with this collar alignment. The x-ray on the right demonstrates the patient, a 50-year-old female, a forward head posture, that is, the head is forward of the shoulder region. And as a result of that, the neck has straightened and caused degenerative joint disease over many years' time. We then put a cervical orthotic collar on her, and we took the x-ray again. You'll note that the fulcrum is placed forward into the upper portion of the cervical spine. You'll note the head immediately is now in proper position over the shoulders, and you also note that the neck curve is right where it's supposed to be on the normal curve line that we have noted here. The x-ray on the left is when the patient returned to the office 10 weeks later, and we note here that the head posture is now corrected over the shoulders, and the neck curve is nicely aligned with normal forward curve line. This is a permanent correction and a permanent reduction of the symptoms the patient experienced initially, which were headaches, neck pain, and left shoulder pain.
After many years of working in the office and in the operating room, I began having a lot of pain in my cervical spine, my lower spine, and found that it really inhibited my work on a daily basis. I came to see Dr. Delano and recently began wearing his collar, and I have had no pain anymore. I'm able to work all day in the office, work in the OR, walk away from the OR table not feeling like I'm stressed and totally in pain the rest of the day.
Almost immediately once the collar came off, I felt a lot of the pressure on my neck was gone. The pins and needles and numbing pain that I was feeling in my arm is mostly erased at this point. I felt so much better since the first use of the neck collar.
I have no more headaches and no more nausea. I can stand up and sit down and not get nauseous or sick, and it's just made all the difference, really.
There's been very little done in terms of improving what we do for neck pain, which is ubiquitous. Some studies show as many as 30 million Americans suffer from some type of neck pain. And most often this is related to postural things that occur in the neck from day-to-day activities. This is innovative, it is cutting edge, and will eliminate the need for people, number one, to suffer from this problem, the need for them to take medications, the need for multiple injection procedures, and certainly the need for surgeries that are currently being performed related to neck pain.
If you suffer from neck pain and headaches associated with forward head posture, this forward head posture correction collar may be all you need to resolve your problems.